Doctors of Reddit, what's your thank God they came in for a second opinion moment? 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did examine, he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit. He lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36 to 48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and ACI was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high. Not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs, suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature, as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, i.e. pulmonary edema, hypoxia, ACI, etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Edit. Some words. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year-old woman. Fairly normal exam. Perfect vision. Retinas showed healthy. But something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird, and she said no. But suddenly reveals this crazy history of an old meningioma, a type of brain cancer she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important. But we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway, just to cover our bases. Fast forward. Patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea. was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test, so I ordered a peripheral vision test. When I got the test back, I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after, this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Her nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. Monsieur, we suddenly and unexpectedly got a cardiac patient. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine that were melanomas. A lot of times people don't want full skin exams. There are lots of perfectly sane reasons for this. Time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction, I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache. When I was 15 years old, and X200B, I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus, and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. And X200B. Around 1 a.m., I was screaming on the floor. And X200B. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left, they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later, she is healthy and never got cancer treatment and has been tested for cancer regularly. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest. X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient.